Health experts believe the pandemic is compounding the problem of childhood obesity across the United States. They say school closures and a virtual learning environment is causing kids to gain weight. According to the CDC, 1 in 5 children and adolescents are currently battling obesity. For more on this,
As shown in the recent news in this video, childhood obesity has been a challenge we have all encountered during our time out on clinical rotations. Our ATED project is titled Battling Childhood Obesity with Balanced Meals and Body Movement, and we thank you for joining us today. Next. Our problem statement for this project. Education on nutrition and traditional opportunities for physical activity are limited for the children in SPA 7. Children need more opportunities for physical activity through accessible resources and more education on healthy food choices within their cultural cuisine to combat childhood obesity that we're dealing with today. Parents of these children also often have limited education about nutrition, as well as the importance of regular physical activity and availability of safe exercise resources for their children. Next. Obesity in childhood has impacts more than we realize. According to the CDC, obesity impacts our nation's health, economy, and military readiness. Children with obesity are more likely to have obesity as adults. Nearly 1 in 4 young adults are too heavy to serve in our military as of late. Overall, obesity has cost the US healthcare system $147 billion a year. According to the World Health Organization, in 2019, an estimated 38.2 million children under the age of 5 years old were overweight or obese. Once considered a high-income country problem, overweight and obesity are now on the rise in low and middle-income countries, particularly in urban settings. Childhood obesity also has an emotional and psych effect on children and the families. Despite a rise in public awareness and zero-tolerance policies in many schools, weight-related bullying, especially cyberbullying, is a common experience for many overweight kids and can have a devastating impact on their emotional well-being. Next. So looking at our SPA data, California has a very diverse population, which many of us are fortunate to experience. And LA specifically is a very diverse in culture. When looking at the SPA data, we found that SPA 7 was in an area which a large portion of the population was affected by risk factors that contribute to childhood obesity. SPA 7 has one of the highest rates of childhood obesity in LA County at 25% of children. And unfortunately, only 19.9% of children in this area get the recommended amount of aerobic and strength exercise per week. In regards to diet, 45.3% of children in this area are drinking at least 1 soda or sweetened drink per day. We had an existing partnership with Loma Vista Elementary from our previous cohort of USC students. The teachers found value in the prior intervention with their students and were interested in participating in this again. That being said, choosing SPA 7 was the perfect fit for our intervention of childhood obesity. Next.
We chose these 3 objectives from Healthy People 2030 as they aligned well with our problem statement. Objective NWS4 aligns with our overall goal of improving obesity in children. NWS 10, which is reducing consumption of added sugars, and PA09, which is increasing the proportion of children who do not do enough aerobic activity, are some specific goals which can help us achieve the reduction of childhood obesity. We felt that these goals were areas in which we can initiate education on nutritious foods to fuel the students' bodies, and education on effective and fun ways to have students move their bodies. Next. In order to have sufficient evidence for our project and to assess the needs of SPA 7, we conducted 4 needs assessments. One of those needs assessments were based on interviews with a pediatrician and other healthcare providers in the community who provided care and witnessed the effects of childhood obesity. During the interview, some questions were asked, such as what contributes to childhood obesity? And the pediatrician would say food insecurity, bad food habits starting at a young age, lack of health literacy in parents. As we asked about what are the health consequences that the pediatrician observed in the patient population as a result of childhood obesity. He stated childhood obesity leads to the future health concerns such as hypertension, diabetes, cholesterol, and other health conditions. Another consequence is that obesity affects the kids' mental health. As social media has become a large part of our society now, kids look at influences of social media and begin to compare themselves with how they should look. This then affects their overall mental health and contributes to having anxiety and depression. And as we asked the pediatrician, are there any resources that the clinic can provide to promote healthy eating and exercises? And do these patients and patients' parents utilize them? He practically stated that there are nutritionists in these clinics that do help them manage their diet. And he refers them out to the nutritionist when most needed, so they can, when they're known for risk of prediabetes, cholesterol, and other medical conditions that can impact their future. Next.
We created a needs assessment in English and Spanish for parents of the students from the elementary school that we've gathered data from. We were able to gather 23 responses in English and 9 responses in Spanish, a total of 32 responses. And as you can see in the pie charts, I will point out a few. We assessed parents' concern for their child's weight. 21.7% of parents were concerned about their child's weight. 78.3% of parents were not concerned. When assessing the impact of COVID affecting their child's daily activity, physical activity, 34.8% of parents reported significant impact, 43.5% reported minimal, and 21.7% reported no change. When assessing the nutritional intake, we surveyed how many servings of fruits and vegetables their child consumed per day. Parents reported 47.8% of 1 to 2 servings per day. Additionally, 56.5% of parents reported their child consumes 1 to 2 sodas, sports drinks, or juices per day, which aligns with the SPA data that we collected, that we observed. Next. In addition, for our Spanish needs assessment, when assessing the same questions, for the concern for a child's weight, 66.7% of parents were concerned about their child's weight, 33.3% of parents were not concerned. As well as when assessing the nutritional intake, we surveyed how many servings of fruits and vegetables their child consumes per day. Parents reported 66.7% of 1 to 2 servings per day. Additionally, 55.6% of parents reported that their child consumes 1 to 2 sodas, sports drinks, or juices per day. In addition to some impact as well of their physical activity as noted in the pie charts above. Next.
Additionally, we did a needs assessment and we took interviews of teachers. To assess the needs of our target group, we created these assessment surveys that interviewed 7 teachers who taught the classes we would be presenting to. When sending it out, all 4 teachers agreed that childhood obesity is a problem in their area. Teachers also reported that students often are not aware of portion control or what a healthy plate should consist of. They reported the diet for students is also very heavy in carbs, and they no longer have a PE teacher, or the equipment that they do have is limited. Teachers are supposed to find time to implement 90 to 100 minutes of exercise per week, but this has been found difficult to do, and only 50% report that they are able to do so. 100% agreed that COVID has affected the amount of movement their students receive per day. Additionally, we did a needs assessment for students, and for our students, we collected 95 student different information. We assessed the outdoor activity and if they felt that they were safe outdoors by asking if they were safe in a park area, in this particular spa area, to see if this was a barrier for movement. The survey reported that 46.3% only sometimes felt safe while playing outdoors or at a park. 14.7% reported they did not feel safe, and 40.2% 0.0% reported they did feel safe. When assessing the duration of physical activity our students achieved per day, we posed the question of how long do you play outside for? These results were more varied, with 37.9% reporting they play for about 1 hour, 26.3% reporting they play for more than 1 hour, and 35.8% reporting they play for less than 30 minutes a day. When assessing nutritional intake, we surveyed how many sugary drinks they consumed per day, with 30.5% reporting they consumed 1 to 2 juices or sodas per day. Furthermore, 57.9% reported they only sometimes engage in PE at school. And we also wanted to look at other platforms students had access to given the time of COVID, if we were to implement videos or other ways for us to engage them in physical activity. And that is the diagram you can see over here to the left or to the right.
Our intervention was a 40-minute interactive Zoom presentation with 5 different classes of 4th and 5th grade students. A total of 96 students participated. The presentation combined information regarding the benefits of physical activity and nutrition. While creating our intervention, we made sure to include portions that would be interactive and have the students participate during the session. This way, they would be able to apply what they were learning. We started the session with a brief introduction of ourselves and explained what PAs do to help the students understand our role in healthcare. We had the students complete a pre-test to gauge their existing knowledge of physical activity and nutrition. Next. We shared our exercise objectives with the students and began asking why they thought exercise was important and what forms of exercise they enjoyed. We explained the ways in which exercise benefits our overall health with the goal of reaching 60 minutes of physical activity per day. We provided the students and the teachers with an activity calendar that we formulated with different exercises they could complete daily. We provided the students and teachers with a blank calendar that they could also fill out outside of our presentation for their own use at a later time. Next. We then played interactive exercise games with the students to get them off their seats and interact with us during the presentation. We introduced the students to different platforms that offer exercise activities such as Go Noodle, YouTube, and Adventure Learning. We wanted the students to have access to examples of exercise outside of depending on media platforms. We included games of Simon Says and gave the students examples of exercises that they could perform at home. Next, we moved on to our healthy eating objectives and explained the importance of nutrition and the ways different foods have different nutrients that our body needs. We shared how poor nutrition can affect our bodies later in life. To reinforce good and bad nutrition, we played a game of thumbs up and thumbs down. This involved showing pictures of different foods that were considered healthy and unhealthy, in which the students had to demonstrate their answers with a thumbs up or a thumbs down. This led us to share My Plate. We explained that My Plate was a tool that students, parents, and teachers could use to help children learn the ideal portions and give the students ideas of what a healthy plate consists of. We had the students draw on a blank sheet of paper a plate and have them fill in foods into different categories to reinforce good nutrition choices. We concluded our presentation with a post survey and asked them questions about what they had learned during our presentation. Next slide.
The pre and post test questions had been smogged to make sure they were suitable for 4th and 5th graders. Next. The majority of students at Loma Vista Elementary are Hispanic and Latinx. We translated the pre-intervention survey among parents into Spanish. We used common snacks such as Takis as a thumbs down food as an example, because they are one of the most popular snacks of this population according to their teachers. We also made sure that the students knew all the unhealthy snacks were not considered bad foods, but were not healthy for our bodies and were not made to be eaten every day. Next. For advocacy and equity and inclusion, we handed out an exercise calendar that was described during the presentation, as well as an empty exercise calendar for teachers and students to use themselves. A handout and descriptions of My Plate nutritional recommendations was given in both English and Spanish copies were made to be given to the parents of the students. We encouraged the students to do a My Plate pledge And during the presentation, students were encouraged to share what they learned with their families. Next slide. We took into account that each student's family may not have access or ability to have nutritious meals, and that the students may be getting fed 2 out of the 3 main meals at the school, which is why we suggest next year's class present to PTA or a school board meeting to target a bigger audience. We were also careful to not use trigger words such as fat during our presentation. Although this was a presentation of childhood obesity, we never talked about losing weight or physical appearance. We strictly focused on health by talking about food as fueling our bodies and exercising for strong heart and bones. Next slide.
For our pretest analysis, we got 79 responses. The response with the lowest number of correct responses was how many minutes of physical activity should you get per day, and only 39% answered correctly with 60 minutes. And one of the best responses was which of these plates has the correct groups of food for a healthy meal, which was 94.9% correct. And the average correct response of the pretest survey was 78%. Next slide. For the post-test analysis, we only had 67 responses compared to 79 from the pretest. So unfortunately, that may confound our results. And the biggest improvement that we had was in the response of how many minutes of physical activity, and 86.6% answered correctly this time. And we had 100% of the kids answer correctly for the healthy plate. Next slide.
While we had great success via Zoom, we do wish we had the opportunity to present in person with healthy snacks and in-person activities. And we also really would have wished we had a parent involvement. Next slide, please. For the next group to do an iteration of this project, we believe that involvement and education of the parents can make a big difference. Because of the ages of these children, these parents have a very large impact on their nutritional choices and availability of different types of food at home. This should include nutritional education for the parents, and if possible, finding resources for parents for affordable, healthy food options. They can also encourage their children to get sufficient exercise at home using the list of resources we provided. Next. Thank you for joining us.